Welcome to Science Force, where science comes alive. A very warm welcome to you all. I'm absolutely thrilled to have you here for this comprehensive explainer on a condition that touches millions of lives across the globe. Today we are unraveling the mysteries of cataracts. We'll explore the intricate engineering of how our eyes naturally function, what goes wrong at a cellular level, and the truly marvelous medical advancements we use to restore vibrant, clear vision. Whether you're a curious medical student seeking some clinical depth, or you just want to understand this for a loved one, you are in exactly the right place. Let's get started. So, diving straight into the fundamentals, a cataract is simply the clouding or the opacity of the eye's natural lens. You see, normally, this lens remains beautifully transparent, allowing light to pass right through and focus sharply on your retina. But when a cataract forms, it acts almost like frosted glass. The light gets scattered everywhere. The direct result? Blurred vision. If left untreated, it's actually one of the leading causes of vision loss worldwide, creeping up on us gradually and quite painlessly over the years. Here is our roadmap for today. We'll start with the healthy eye lens, move into pathology and risk factors, look at the types and symptoms, cover diagnosis and surgical treatment, and wrap up with prevention and key takeaways. Part 1. The healthy eye lens. Tucked neatly behind that colorful iris and the pupil, your natural lens is a brilliant piece of biological engineering. It's totally transparent and highly flexible. It's primarily made up of water and specialized proteins. For our medical students tuning in, these are known as crystallins, and they are aptly named. Their precise arrangement keeps the lens crystal clear, allowing it to dynamically change shape and focus light perfectly. That's what gives you a sharp, high-definition image of the world around you. Part 2. Pathology and risk factors. Now, as we age, those perfectly arranged crystalline proteins suffer wear and tear. They break down, get damaged, and start to aggregate or clump together. Think of it a bit like the clear part of an egg turning white opaque as it cooks. The proteins literally lose their original structure. This clumping forms the cloudy areas we call cataracts. The lens thickens, loses its transparency, and slowly steals your visual clarity over months or even decades. And that brings us to a massive number, 60. Aging is by far the primary risk factor. In fact, the vast majority of people over the age of 60 will develop some degree of cataract. It's a completely natural part of the eye's aging process, much like getting grey hair, isn't it? But age isn't the only culprit here. There are vital systemic and environmental risks we must consider. Diabetes mellitus. Excess glucose in the lens converts into a sugar alcohol called sorbitol. This aggressively pulls water into the lens, causing it to swell, damaging proteins, and leading to much earlier cataracts. Oxidative stress. Accelerated lens aging from prolonged UV radiation, smoking, and excessive alcohol. Other factors: long-term use of corticosteroids, eye trauma, and even congenital causes in newborns. Part 3. Types and symptoms. Crucially, not all cataracts are exactly the same. We classify them by where they form. Nuclear cataracts, these form right in the center, and they are the classic age-related type. The lens turns yellowish-brown, which fades the colors you see. Cortical cataracts, these start in the outer edges as white, wedge-shaped opacities that scatter light. Posterior subcapsular cataracts, this one forms at the back surface of the lens, often seen in diabetics or steroid users, and it progresses very rapidly, causing severe glare. Congenital cataracts, these are present at birth and require urgent attention so they don't permanently stunt a child's visual development. To truly understand the patient's daily reality, having a cataract is similar to looking through a dirty window. Imagine trying to appreciate a beautiful landscape or read a beloved book, but there's always a stubborn, foggy film standing right between you and the world. This translates into some really bothersome symptoms. Blurred vision is standard, but patients also suffer from intense glare sensitivity and see glowing halos around streetlights, making night driving absolutely terrifying. Also, because of that yellowing we talked about, vibrant colors appear muddy and dull. Fun fact for you, art historians actually believe the famous painter Claude Monet's later water lily paintings became increasingly red and yellowish precisely because he was developing severe cataracts. Part 4. Diagnosis and surgical treatment. Diagnosis relies on a comprehensive eye examination. It starts simple, with a visual acuity test. Then the ophthalmologist uses a slit lamp examination. This is a highly specialized microscope providing a brilliant detailed view of the cornea, the iris, and the lens itself. Finally, with a dilated eye exam, special drops enlarge the pupil so the doctor can fully evaluate the opacity and ensure the retina at the back of the eye is perfectly healthy. Once we've diagnosed this foggy, damaged lens, how do we fix it? Can we reverse the protein damage? The plain clinical truth is this: surgery is the only permanent treatment. In the early stages, stronger glasses or anti-glare sunglasses will certainly help manage the symptoms, but they don't cure the cataract. To permanently fix the problem, that cloudy lens must be surgically removed. And thankfully, it's among the most safest and miraculously successful procedures performed anywhere in the world today. Let's demystify this brilliant procedure called phacoemulsification, an elegant process that takes less than 30 minutes. The surgeon makes a microscopic incision in the cornea. A tiny probe uses high-frequency ultrasound to gently break up that cloudy lens. Those little fragments are safely suctioned out. A brand new clear artificial intraocular lens is smoothly inserted. The incision is so incredibly tiny, it usually heals entirely on its own without a single stitch. Absolutely amazing. And the artificial lenses we're using today are wonderfully futuristic. Monofocal lenses provide excellent clear vision at a single distance. Multifocal lenses act a lot like progressive glasses, allowing focus at varying distances. Toric lenses, specially designed to simultaneously correct astigmatism while replacing the cloudy lens. Part 5. Prevention and key takeaways. While we certainly can't stop the clock on aging, we can absolutely take charge of our lifestyle. Make it a habit to wear high-quality UV protective sunglasses. Avoid smoking entirely. Eat a vibrant diet full of antioxidants to fight off cellular stress. Strictly control your blood sugar, especially for diabetic patients, to prevent swelling in the lens. Keep up with regular eye exams. Final thoughts. As we wrap up this explainer, I want to leave you with an empowering thought. Cataracts may be a natural part of growing older, slowly acting like a dirty window over your beautiful view of life. But with modern surgery safely restoring crystal clear vision in a mere 30 minutes, why let a cloudy lens dim your world? Take charge of your eye health and never settle for a foggy view. Thank you so much for joining me today, and keep learning.
Thank you for watching Science Force.